Is it time for the country to reopen?
I think in certain parts there definitely is, and I think that you have to do this at a local level, to be honest with you, because as you may know, the 2nd District of Ohio runs from Cincinnati to Portsmouth with a lot of rural areas in between. If you just take a look at some of our hospitals, in many of the counties, we've only had one admission for coronavirus. And so people in those areas aren't seeing what people are seeing, say, in Cincinnati or what they're seeing in New York. And they don't quite understand what it's all about. And I have to look on the healthcare side, especially as a doctor, but you look at this holistically. How much care are we putting off? How much can we put off before it has its negative effects on people? And not only that, are there effects mentally as well as physically that are taking place with people? So does the benefit outweigh the risk? I would really like to see decisions made at a local level with healthcare professionals, the health directors from the counties evaluating a hospital, a business, or whatever, and put in place plans where they can reopen and do it safely so that we can get our economy going again. But also, I think it'll restore the health of a lot of other people, not just by opening the hospitals, but businesses as well.
How long do you think it'll take to return to normal?
Well, I don't know that it'll ever be exactly the same for us in some ways. It's sort of like after 9/11, where, you accepted the idea that TSA is going to be a part of our lives, right? And so I think for some, especially if we start to see outbreaks of certain things that we don't have immediate cures or treatments for, then we might have to do things like take your temperature at the door and things like that become a new normal for us, if you will. But it's hard to say with this virus. It's highly contagious. I don't think it's as lethal or as fatal as people thought at the beginning. When it came to a lot of those models, I was always taking the approach, well, our job is to beat those models. And I think we've done a pretty good job of that, if you remember some of the numbers people were throwing around. And mitigation maybe has done a lot of it. But you got to look at some of the unintended consequences of the actions over a long period of time and try to get things back to a normal, or at least a new normal, as soon as possible.
You mentioned the positive benefits of what has and hasn't been done. In your mind, what has been the biggest success by the government and the biggest failure by the government in all of this?
Well, I think one of the biggest successes that we're seeing is the PPP program that was put out, the Paycheck Protection Program. Very popular, and as Congress, we came back to that well, if you will. Not that we like spending money like this, but this is a national emergency, and we were able to get out and help people. The goal through all this, with a very rapid, broad brush response, has been try and allow employers to keep their employees and try and allow employees to be able to pay their bills. And let's get through this and let's get back to work. So I think the bipartisan work that has been done is one of the accomplishments that we can be proud of. But that was our damage control. And although there's still areas we need to address, I think it's time for recuperation. It's time for us to look at ways that we can start to heal the wounds that have taken place from this virus, and do it as quickly as we can, smartly and in the right places at the right time.
Anything that sticks out to you that could have been done better?
Well, I think there's a lot of things that could have been done better, and I take that from a global standpoint. I served on Cincinnati Board of Health. You rely on data. You rely on reliable, accurate data. And I think there's a real concern of what's taken place in China. I've done a lot of research on this with other physicians and reading articles. They knew a lot more about this much sooner than they may have let on. And I don't think that we were getting accurate data from them. And it's concerning when the World Health Organization, which is an organization that's to be there and put politics aside and to look out for mankind, is seemingly giving bad advice. If they're saying you shouldn't restrict travel, well, we know that we should have. And we did, even though they were saying we didn't need to. Another concern too is, China restricted their domestic travel, but they allowed people to leave. And that to me is a great injustice through this whole process, because if you know you've got a problem, you're not allowing travel in your own country, but you're letting people spread it around the world. Those are things that we really need to take another long, hard look at and probably change the way we do business.
What about the federal government, the U.S. government? What do you think that, either locally or nationally, we could have done better?
Well, I mean, I think if you can, look back and you want to be an armchair quarterback, you can always say that we should have shut things down maybe even sooner. But even when that was done, there was criticism of that. I believe the president was called a xenophobe by so many when he was restricting travel from China. And then he restricted travel from Europe. Well, I don't think that that would be xenophobic, but the idea was using science, but you have to have accurate science. So we could have done some things better, but I think some of those decisions would have been better had we gotten accurate data.
Gotcha. What should happen with schools? I mean, I know the president was talking to governors about possibly letting kids go back to school before the end of the school year. I know Governor DeWine has mentioned having some safe, socially distant graduations. Others are saying, are you crazy? Just wait till the fall. What do you think should happen?
Well, again, I think you take a look at the areas of concern. If it's New York City, it's going to be different than Hillsborough, Ohio, in my opinion, or areas of Brown County, Adams County, et cetera. So I think it should be different, but you should start to look at some of the numbers. And across the country and around the world, we're seeing that school-age children, especially elementary school, were not getting this, or if they were not producing symptoms. So if the idea is there to be protecting the children, then I don't know that we're necessarily doing that, and maybe they can return back to school, and that's something that should be looked at scientifically. Obviously, I think it's important that you have your teachers tested and know that they're healthy going into the classroom, and all those that would interact with the children. But I think you can consider it just based on the numbers and who's been affected through this process.
How much further should Congress go to help local governments, states and locals? Senator Brown had a couple of mayors from Ohio talking about, because Ohio's funding model is different than other states. You rely a lot on income tax and sales tax, and those have obviously been decimated. Parma and Lancaster are laying off firemen and policemen. Other municipalities are looking at those kinds of same things. I know there's a broader discussion about what this should or shouldn't be used for, pension plans and all that. But here in Ohio, with the funding situation as it is, do you think that Congress should be helping states and local governments, or should be going further?
Yeah, well, the one thing that about Washington is recognizing that sometimes one size doesn't fit all across our country. And we were just on a call earlier with Treasury Secretary Mnuchin, and it was a bipartisan Ways and Means committee phone call. And, a lot of people brought up how so many of our local communities, our cities, townships, they're really struggling. And was also mentioned how some states got more money than they know what to do with. And I think some of the intent here was for monies to go to the state and they decide what it should go to their local communities. And I don't know that that's being addressed. And I think that our mayors and our smaller communities need to address that with their state governments.
As a doctor, seeing this from a healthcare perspective, do you think the country is ready for a second wave if this comes back at us? If we have another resurgence of coronavirus, say in the fall?
I think we really can.
Do we have the capability of fighting it better than next time around?
Yeah, I think we can be, and here's why. I think we do need to continue to practice social distancing until we see that this has receded much, much further across the country. And I think people have sort of adjusted to making those precautions right now because, to face it, nobody really wants to get sick. But here's where I have hope, because we can do a whole lot more on testing. And besides the actual test for the coronavirus, there are other things that you can do. And I can tell you this as a doctor, you can get CAT scans of the lungs and detect something earlier. You can get blood work and see markers like something called IL-6 that elevates. It's an inflammatory reaction. You can see what's called lymphocytopenia, where the white cells drop. So you also can test for antibodies being present. So there's a lot more we can do with detection along the way and other clinical signs that people can pick up on so we can get on it earlier. But one of the things that to me is the earliest form of hope right now is the convalescent plasma. We are finding out that many, many people have this, didn't even know it, got better. They carry antibodies that can help someone else. And I've been, every chance I get, and I'm glad to have this opportunity with you, to make the push that if you've had this, talk to your doctor, talk to Hawksworth Blood Center, and look into donating your plasma so that you can help someone else. So this can be done with antivirals. This can be done with other treatments as well. So it's one thing that's showing to have promise. It's been used in Mount Sinai. It's been used in Cincinnati now. So we just need the volume, right? We need the people to donate. So I think that by fall, we'll have a better understanding of what's working, what's not working. And we should have, hopefully, a bank of convalescent plasma, which carries the antibodies to fight this virus.
The president, apparently the White House is coming out and they're going to, when the latest set of recommendations expire next week, they're going to say we don't need to socially distance anymore. You just said you think we should be, especially in harder hit areas. What's your reaction to the White House saying that?
Well, again, I haven't heard what they've said exactly yet, and that's conjecture of what they're going to say next week. I think they're probably going to say we still need to be cautious, especially in a lot of areas. We want the American people to understand how this is spread. And so it's practicing good hygiene. You know, for me, if you think about this in the medical community as a surgeon, for example, you know, we operated on patients with HIV, or we operated on patients when we didn't know if they had HIV. And at that time, it was a death sentence. But we still took the risk and took care of people. Why? Because we took the protective measures, but it's the same protective measures that we always use. And so hopefully people will be more vigilant about taking protective measures, just like they would during a seasonal flu.
Well, that's all the questions I have. Is there anything else I didn't ask that you wanted to talk about?
I think we should be back in session next week, to be honest with you. The Senate's going back. We were going back. Then there was some concern, I think, more from the Democrat side. I'm not sure. But we as a group, I think we're willing to go back and take those very precautions. You know, when we went back last week to vote in the House, we just went in waves onto the floor. We socially distanced, people wore masks. So I think, you know, there's no reason that we can't go back and start to engage with one another. I'm happy to do it, but I'm conference called out.